Good afternoon. Welcome to this edition of Advocacy Insights from NEHA. I am Doug Farquhar, Government Affairs Director for the National Environmental Health Association. For this month's edition, we have a research associate from the University of Illinois in Chicago, Susan Kaplan, who has recently completed a book called A Healthy Union, which talks about environmental health in this country and about how the difference between federal and state efforts have led to our current makeup of the profession. Before we get too far into the interview with Susan, I'm going to give you a quick update of what's going on regarding government affairs as of early December. We still are where we were a month ago in the sense that the budget, the appropriation for Health and Human Services has not been identified, has not been finalized. The CDC does not know what their budget's going to be, nor the rest of HHS, with the exception of FDA. The Food and Drug Administration, which is funded under the Agriculture and Food Appropriation, that did get adopted. The fiscal year 26 appropriation has moved forward, so we know how much money we're going to have for FDA. But over at CDC, we're still up in the air. There's been discussions in the Senate of combining several of these appropriations and trying to get them through in a single massive omnibus package. But that doesn't have agreement yet in the House, and the agreement in the Senate is somewhat haphazard. So we aren't sure what's going to happen. Right now, both the House and the Senate are in session. They are working through this to try to get a bill passed by the January 30th deadline. But we don't know how that's going to play out. A couple things we do know is that we have a proposal out by the Department of Education, which is designed to declassify, redefine professional degrees and not include the degree for public health. This is going to have a huge impact on the environmental health community because we will all of a sudden lose that credential, which means we'll lose the opportunity to get federal funding or limit federal funding, opportunities for federal funding to pursue these degrees. It will mean we'll have less masters, less doctorates in public health, and it's a concern. And NEHA is taking the lead on this, is addressing this. We are going to reply directly to Congress from our board on this issue, but at this point, it is still a concern for the public health community. But we want to talk about what's occurring with the environmental health community under the book that was recently written, A Healthy Union by Susan Kaplan. Susan, you're with us today. Very happy to have you here. If you'd like to say hello to our audience.
Hello, and thank you, Doug, for having me on your program.
Thank you. I'm glad you agreed to be with us today. First of all, if you could let us know briefly about yourself, what led you to write this book?
Sure. I'm a lawyer by background, like you, Doug. So I've worked in federal government. I worked at OSHA, developing workplace safety and health regulations. I've worked in state government. I've had some involvement in local government, and I've also been in academia. So I'm primarily at the University of Illinois Chicago School of Public Health. And, I think I have always been aware that there are some shortcomings in environmental health protections at the federal level. And then I started doing some advocacy in my own community, and I think the extent of those gaps became clear to me in a sort of almost a personal way more than they had before. And at that point, I started to look at state environmental health protections. And I looked at what my state that I lived in that time offered. I looked at other states, states that I did work in, and I realized they vary widely in terms of the environmental health protections they offer. So I thought, this is a really interesting conundrum. We have shortfalls at the federal level, which I'm aware of from my work at OSHA. I worked with a crew of incredibly committed, hardworking people. Nevertheless, there are gaps in those federal areas. And then you look to the states, and there's this enormous variation, so that to some extent, you can have protections from a certain kind of pollution in one state, and then that's lacking in the neighboring state. And I thought, wow, this is really interesting, and I wanted to learn more about it. And that led me to write the book.
And if I remember reading your book, your son has was sensitive to certain pesticides, wasn't he?
Yeah, so I have worked in this field of environmental and occupational health sciences and policy for my whole career. Then I had an experience with one of my children being diagnosed with asthma. And at that point, I became aware, which I just hadn't before because I hadn't had to be. I became aware of some of the environmental triggers of asthma problems. So those can include pesticides, they can include some cleaners and disinfectants like bleach and what are called quats or quaternary ammonium disinfectants, which were
Okay.
widely used during COVID, and a whole range of outdoor air pollution. So elevated ozone levels in the summer, particulate matter, diesel exhaust, etc. And so these can all be asthma triggers, and I started to learn about that. They're also more than asthma triggers, though. They can also be linked with other health problems.
So there's no place, there's no, safe zone for your son because there are so many, or your child, because there's so many triggers for asthma in our society out there.
Well, it depends. So, if your school or your community has a policy to address the use of cleaners and disinfectants or
Mm-hmm.
the use of pesticides, you might have a safe zone. So again, I realize that it depends so much on what's happening at the local and state levels because there are so many gaps in federal protection. So it very much depends.
And it was very interesting. If I remember correctly, doesn't Texas engage in certain school-based protections that you identified, or was it another state that we tried to that you
You're
looked at?
you're right, it was Texas. Uh-huh.
Yeah, it was interesting that they took that approach.
Hmm. Yeah, so my book looks at different best practices that states around the country have taken to protect environmental health. And I wanted to look for state best practices across the political spectrum. And I was very gratified that I found state best practices across the country, across the political spectrum. And yes, so Texas, for a number of reasons, had one of the first. I think it goes back a few decades and has one of the strongest state laws protecting children from pesticides at school. And it's an example of a partnership that is very effective. There are a number of state agencies that are involved in implementing this law. A key is the Texas A&M University Cooperative Extension Program.
Mhm.
They visit all 254 of that state's counties to provide education to school coordinators and other staff about reducing pesticide use and how to implement a low pesticide approach called integrated pest management.
Right.
And then industry, in terms of pest control professionals, are also treated as partners. And so this kind of partnership and in-person technical assistance has been very effective there.
Yeah, it's interesting, and it's an EPA policy, integrated pest management, but it's not a regulation. It doesn't
Correct.
mandate they do. So we're really relying on the states to make the decision whether they want to go down this path or not.
Yes, correct.
Yeah, and I've noticed that there's a dramatic difference based on what they have to address. You get the Gulf Coast states, and they have certain bugs and
Mhm.
issues that they have to try you don't have to deal with in the northern states or in the western states, but it's a very critical issue in those states. Did you find that when you were looking at this that there's just a wide variety of the policy approaches to environmental health?
Right. I think there is a wide variety of approaches, and I think as you're referring to some extent that depends on the challenges of that state. So when we think about climate change, they're going to be very, very different from one region of the country to another. There are areas of the country that are dealing with wildfires
Mm-hmm.
and heavy smoke. There are areas that are dealing with algae blooms in the water, areas dealing with flooding. And of course, flooding has a whole can cause a whole cascade of impacts.
Right.
So when you see people walking through these flooded streets, and the water can actually be full of toxic chemicals from whatever might be in that area. So um I think when you think about that, it makes sense for different states to sometimes do things differently. In other situations, it probably makes sense for kids at school to have certain basic protections, certain baseline protections.
Yeah, I remember yeah, Florida, for example, they have such a low-lying area. They have these little I want to call them ditches. And so much floodwater flows in there, but it takes with it all the toxins off
Mhm.
the grasses,
Yeah.
all the everything that's been sprayed to keep the bugs down. And then also you get sewage overflow
Hmm.
and they sit in these areas. And so it's a real amplified hazard to have flooding in Florida
Hmm.
versus some other states.
Hmm. Right. Or any sort of industry that might have toxic chemicals in their factory that could potentially also enter those waters. So yes,
Right.
exactly as you're saying. Right.
So, what was it? Anybody who really stood out in your interview? You spent a couple of years doing this, didn't you?
I spent about a year.
Uh-huh.
Hmm. Yeah, and so I interviewed some of the leading lights in environmental health protection in the country, which was a huge pleasure and fascinating. Um, so some of the people, so the main point person for the Texas school pesticide law, Janet Hurley with the Texas A&M Extension Service. I talked with her extensively, and she is one of the leading people in the country for this issue. One of my chapters focuses on the best practice of community action.
Okay.
And that chapter looks at a law in California to protect vulnerable communities from air pollution. And I had the pleasure to talk with Professor Jonathan London at UC Davis, who has analyzed this law for a number of years since it was enacted in 2017. And anything that happens in California California would be the fourth largest country if it was a country.
Right.
So anything that happens in California is huge and incredibly complicated, and everyone looks to them to see what's happening. So Professor London was fascinating. And then California has its own state agency that does nothing but work on air quality issues, the California Air Resources Board. And I
Right.
had the honor of talking with the physician member of that agency, Dr. John Balmas. He also is one of the leaders in this country on environmental health protections. And so that was fascinating. And a number of others as well.
Yeah, California is has it always been very unique. Every issue I've ever dealt with them, and part of it is the way it's set up. You know, they got very strong counties. They have a lot of say. The legislature can adopt policy, and they come up with budget numbers, but it's up to the governor. So I think it leads to a little bit different makeup, but they have been able to come up with a lot of enlightened programs. And I always found it interesting the way California will address a problem versus Texas, which is second largest population, the largest size. It's in many ways it's very similar to California, but you get a situation there where the California budget is 3 times the size of the Texas budget, so they're just limited on what they're able to do. But you still found that they were able if the Texas policymakers have a problem, they will address it. And that's what I got from your talk about integrated pest management.
Well, this was one specific issue I was looking at. And in this situation, I can't really speak to the remainder of Texas efforts on environmental health. But in this, it was very comprehensive, very impressive. The Texas A&M Cooperative Extension Service has worked with communities for years. People trust them, people look to them for their expertise. You know, professors are doing research to help move forward knowledge in this area of pest control. And at least on this issue, it's a real model.
Was there other models? Are there other issues out there? Let's put it this way. Um, what were some of the better policies that you've seen out there in your research?
Yeah, so I'm sure you're familiar with the Massachusetts Toxic Use Reduction
Reduction. Yeah.
Act.
Yeah,
And
Charles.
so TURA was enacted in 1989. And so we have decades of experience looking at TURA implementation. And TURA is so innovative and it's also been so successful. And so many people have tried to understand this law and what makes it so successful that I actually felt like I was wading through an ocean of TURA analyses while researching that chapter. And that is really a best practice that a number of other states and Canadian provinces have looked to. And so in that law, the state develops a list of lower and higher hazard toxic substances. And any business in the state that uses or manufactures a certain amount has to make a plan to reduce their use of those toxic chemicals. And
It's a pollution prevention type operation.
so it's pollution prevention. So we're trying to prevent pollution from the start, which is of course a more effective approach than polluting and then trying our best to clean it up later, as in the
Uh-huh.
case of Superfund or brownfields. And similar to the Texas law, there is not an expectation that factory owners should be able to know how to do this on their own. They get very extensive technical assistance, all sorts of assistance from the state. The State Office of Technical Assistance is available to meet with any business that requests their help. And when that office comes and visits the business to help them figure out how they can make changes to their products or processes to reduce toxic chemicals that they're required to make plans to reduce under the law, that business is guaranteed confidentiality. So they know that if someone from the state is coming to visit them, as a result of that visit, they will not be written up for some sort of a violation. And so there's really a sense of partnership. And again, we have State University as an important partner, and that's the University of Massachusetts Lowell Toxics Use Reduction Institute. They do cost benefit analyses of companies that have made these changes. They do case studies. They have a laboratory where they can test potential safer substitutes for toxic chemicals that are on the state list. And so, again, we see that it's a real partnership between several state agencies, the public university. It's not an extension program, but it's a specific institute set up to do this work. And industry, which works to remake their products and processes to address the requirements of this law. And it couldn't happen without them. They're the ones who have the day-to-day experience with their own industrial processes. Companies will ask their workers for their input, and a lot of times those workers have seen things that could be done differently, and it's been very successful.
That's a real public-private partnership. They're working together to solve a problem.
Mm-hmm.
Have you seen, have there been other states you've seen policies like that, or other policy you think we should highlight?
Yeah, another really great policy is in the state of New York, and this one has to do with environmental health education.
Oh, okay.
And one of my conclusions from writing this book is that environmental health education, or an understanding of how the physical environment affects human health, really underlies every one of the successful programs and policies. In other words, you have to have that understanding if you're going to move forward.
Yeah.
And so that was one of my big takeaways.
Where's that taught? Is that a university course? Is that in the high schools? Where's that taught?
So environmental health education is, I think we would primarily look for that in academic public health programs, Master of Public Health, Doctor of Public Health. We also would hope to see some of it in medical school curriculum, not only for people who plan to go into preventive medicine or environmental or occupational medicine, but really for all physicians. We would hope to see that, and it's largely lacking.
Yeah.
One of my arguments in my book is that environmental health education can start from elementary school. And I give a few examples in the book. One of them is young children can learn about air quality and air pollution using the U.S. Environmental Protection Agency's Air Quality Flag Program.
Okay.
And that's an example of an EPA, not a regulation, but an educational program. And kids can learn about what their air quality is like near their school today. And that can lead to science lessons about what does that mean? What causes it? What can we do about it?
Yeah, it's great to start at the elementary level, but we're having a battle at the university
Yeah,
level.
right.
Like you said, taking it out of medical programs, taking it out of public health programs, occupational health doesn't know about this. And it's a real detriment because, they, when they get into the workforce, they won't see the problems out there. They will not be able to identify the environmental culprits that are causing this, which could be really, yeah, it's going to be very detrimental. It's a battle I think we got to continue to fight.
Right. Well, I heard your news at the beginning, and so clearly many challenges.
We do have many challenges. The schools of public health is very active on this, which is great, but it also shows that we have a current lack of understanding about the importance of public health and what it means. One of the things, and we probably have talked about this before, but I often bring up the fact that the Obamacare, the ACA changed the paradigm out there in the States. What I mean by that is all of a sudden, when you have this program, when you have to pay for Medicaid, Medicare for a good chunk of your public, it's going to cost your bottom line. And right now, the number one cost for states is health. It used to be K through 12. It used to be prisons. It's now health. And that's all occurred since the adoption of Obamacare, the ACA. And so I'm seeing states have a different opinion of public health. And it's not universal by any means. But we do see people out there, policymakers say, if we can curb the problem up front, we can do pollution prevention. We can have less pesticides. We have less toxics out there. It's going to, it's going to cost us less in the future because we'll have a healthier population. And I actually saw that quite a bit when talking with Mississippi. They are clearly understanding about their poor health outcomes. Obesity is bad, smoking, eating, lack of exercise. These are all critical issues. But they've started to say, this isn't just a general problem. It's something that's hitting our bottom line. Have you seen that out there? Did you get that sense from the states that public health is real, it has value? Or did you hear a lot of no, they don't understand us?
Yes, in every state example in my book, there was an analysis done of the return on investment of that program.
Right.
And I think that's critical. I think budgets are tight everywhere. And I think that when someone says, hey, let's start this green program, it sounds really good. The first question that someone who's voting on that will ask is, well, what's it going to cost?
Yeah.
So, and I think that's completely understandable. And so in every case, there has been a cost benefit analysis, a return on investment analysis. And in every case, a lot of benefits have been found, not only in specific dollars related to the specific policy, but often even broader than that. So, I mentioned the Massachusetts Toxic Use Reduction Act, and so they have done a whole range of studies of companies and industries that have made these changes. And they find that when a company reduces its use of a toxic chemical on the state list, they save money on hazardous waste disposal costs, which include a lot of fees and other costs. Often in the process of making a change, they rethink some of their processes and get to greater efficiencies and save on water, save on energy, have healthier workers, have more involved workers. And so they're finding that there are cost savings. And in fact, the stated goal, or at least one of the stated goals of the law, is to protect public health while enhancing the state's economic competitiveness. So those
So it's
two,
just sustainability.
so those two things aren't opposites. They actually go together. Another example is Tennessee.
Okay.
So Tennessee is one of my best practice case studies for health and all policies,
Mhm.
where you have state agencies, instead of working in silos, they get together and they work together. So in Tennessee, which is one of the leaders in this arena, 24 representatives of 24 state agencies meet on a regular basis to get to know each other's work. And a few years ago, they analyzed the outcome of this effort, which is called the Tennessee Livability Collaborative. And they found that they had reduced duplication, just kind of a basic thing, that there was one entity working on metrics for some issue. There was an agency working on metrics for the same issue.
Mm.
And because of this collaborative, they realized this and they combined their efforts. So they reduced duplication. So this effort is also helping them to become more efficient, to make their dollars go further. So they're coming up with creative ways that agencies can work together on grant applications, on programs, so that they can be more efficient. And again, just making these scarce dollars go further.
Yeah. I've often thought about that, and with the health and all policies approach, which has different manifestations
Mhm.
out there across the country, but it really does bring a point back that no matter what you're doing, transportation, uh, school policy, pesticide policy, whatever, you're going to agriculture policy, it all has an impact on the public's health. And if you have an impact on the public's health, you really need to have people there who can identify. It's not so much you can answer every problem. You need to be able to say, that's going to impact the health. Uh, they were having a discussion about driving big mining trucks down dirt roads through this town. Well, that's going to have an impact on the kids' respiratory thing. And they wouldn't have known that had they not had a health and all policies approach.
Great example.
Yeah. So here you have years of I don't you have an experience at OSHA. You've done work at the federal level as well as study the state activity. What works well at the federal level, and what are some of their limitations?
Well, a lot works well at the federal level. There are certainly a number of laws that are seen as terrific successes. Certainly, the Clean Air Act is one of the most important public health laws in our history. Um, I think other laws and regulations that maybe we need to protect environmental health get held up by divisions, partisan divisions, different perspectives about the proper role of the government versus, maybe the government should step aside and just, let things happen. So, that's a little bit of a mixed bag. The federal
Sure.
government, undeniably it is in a 100% unique position in so many ways to, for example, collect data from all
Mhm.
50 states and analyze that data and then give it back to the states to help them with what they're doing so that they can make improvements. There's no other government entity that can do that, that can analyze data from all 50 states to understand what are the big health problems? Where are we with asthma? Where are we with understanding it and what the triggers are and where we're finding it in the country? Um, and, we mentioned that integrated pest management at the US EPA is not a law, but
Yeah.
they provide a great deal of guidance. They have a terrific model policy with additional associated guidance that any school district or local government can adopt. So I think there's that, so I think on the one hand, you have laws and regulations. And then I think on the other hand, you have this very unique ability to help the states, and the states, um, they need that guidance. And an example was certainly during COVID,
Mm.
when state health departments were dealing with this novel situation, really needed data, really needed guidance. And that's where no one can replace the federal government.
So I don't want you to get too political here, but with the current effort out there to kind of pull back on federal workforce, federal resources in this, um, you you believe that's going to hinder the state responses, the state ability to address these issues?
Oh, yes. And to me, this isn't a political issue. I think, clearly, every state was struggling during COVID as just one example. So something like that sort of novel situation, you might have a great state health department, but nothing is really going to replace that federal ability to understand what's going on nationally.
Yeah.
And so, sure, again, I don't think it's political. I think, we need that very well-trained, sophisticated workforce to be able to do that to assist the states.
So there's a real ability that's unique to the federal government to collect this data, to come up with the metrics to say we're improving, we're hurting, where should we really target ourselves, and then they can, by providing this information to the states, it allows the states to fashion their policies to address whatever's affecting them.
Right.
What e- e- environmental health at the federal level is really bifurcated. I mean, EPA has a role, but so does CDC with the National
Mhm.
Center of Environmental Health and emerging zoonotic and infectious disease. You also have a role over at FDA with food, USDA with meats, HUD with housing, um, OSHA with worker safety. Is it does it make sense to combine this together? What's the advantage of being so diverse at the federal level?
Mhm. Well, I'd be interested in your thoughts about this. We just talked about health and all policies at the state level. What about health and all policies at the federal level? I remember there was discussion about this, and there was something developed called the Partnership for Sustainable Communities, and it was a
Yeah.
partnership of 3 or 4 agencies. It was EPA, transportation. Maybe you remember the other ones. I don't. That was an effort. And if agencies were able to work more closely together to protect environmental health using a health in all policies kind of approach, it seems that might have the same sorts of benefits we see with that approach at the state level.
That would be really, smart because there's a real, it's kind of like a mission. I don't want to call it mission creep. It's mission direction. EPA's mission is to protect the environment. CDC should protect the public health. Um, and they don't necessarily talk the same language. It's very interesting. And with the health and all policies, it could provide like a CDC public health person within EPA, within each policy. to have that dialogue. You do see, I know, like with FDA, they work closely with the CDC about food safety, but each one has different missions. They have different people they need to report to. They have different budgets, and it does change it out there. But that would be really interesting if we can have them all at least have a discussion on, or someone there who knows public health and the impacts of
Right.
it. Yeah. You make some, I think you learned a lot from writing this book. At least that was my impression. What were your
Yes.
key takeaways from writing the book A Healthy Union?
So key takeaways, I think I already knew about the lack of environmental health education, that it has been reduced somewhat at the Master of Public Health level, that it's very minimal in medical schools. I think one big takeaway, which I mentioned already, is that I think environmental health education is absolutely fundamental. So every one of the best practices in my book is built on an understanding of environmental health. So I think that's one takeaway. And an example that came up, and you're right, I really learned a lot. This is something I hadn't thought about, but that I learned about writing the book, is that because New York State has an extensive an extensive network of occupational health clinics that's state-based and unique. No other state has this. They have, I think, 11 occupational health clinics located throughout the state. That's one of my best practice models in my book. Because of that, the clinic that's in New York City, within a few days of 9/11, September 11th, 2001, when the World Trade Centers fell, and emergency responders were working in clouds of toxic dust. Within just a few days, the physicians at the clinic, the New York City-based clinic, were able to start diagnosing and treating them. And they have a registry with tens of thousands of workers who had some exposure to that toxic dust. And they're tracking them to understand health outcomes. And then it was so interesting to me when there was the train derailment in Ohio, in a small
East
town
Palestine. Yeah.
in East Palestine a few years ago. And I think it was right in a residential neighborhood. And I learned that very few of the first responders were wearing respiratory protection, even though inhalation would have been the major source of potential exposure. And people were going to their doctors and asking, am I going to be okay? What should I do? Can I move back into my house now? And there wasn't something like the New York clinics that were set up to be able to respond. And so there was a real scrambling to understand the situation and advise people. And so you see the distinction between a state that has this strong base of environmental health education and then another area that doesn't. So that was one big takeaway for me. I think another was that you find these best practices across the country and across the political spectrum, and I was very gratified by that. Another big takeaway, I think, is just the extent of state success stories. The Massachusetts law has been around since 1989, the Texas law since 1991. That's decades of experience to look at, and they've both been analyzed extensively. There's no need to reinvent the wheel. Those models are there for any other state that wants to learn from them. Another takeaway is that there's been a real growth in regional efforts. So, one of the models in my book that I looked at is the regional greenhouse gas emission.
Okay.
Regional greenhouse gas initiative of, I think, 12, 13, perhaps 14 states on the East Coast,
Right.
from New England down to the Mid-Atlantic, that are working together to reduce CO2 emissions. And in researching that, I found that there are several other regional efforts around the country to address climate change. And we certainly saw during COVID, there were two regional efforts among groups of states to try to track personal protective equipment and share it. And so I think regional efforts are really on the upswing. Um, yeah, I think those were some of the key takeaways and things that I really came away with.
Yeah. The final question I'm going to have, I don't want to keep all afternoon with, even though I'm enjoying this tremendously. Um, what key changes do you think should occur, or we should that are needed for the environmental health profession?
Well, I think, unfortunately during COVID, addressing the virus became very intertwined with politics, and you did a certain thing because of your political orientation. I think it's really important to keep politics out of it and to focus on data and just to go to the research studies. So I think that's one thing. And I think there's a role for us to demonstrate what environmental health is and how critical it is, even though it's hard to see.
Yeah.
And it's especially hard to see when it's doing its job. There's always been this problem that, when the restaurant kitchen has been inspected, that's great, but there's no problem. So people don't realize that that's happened. Um, so I think making the invisible visible, and again, there were examples of this in my book. So with the New York State clinics, uh, a network of both occupational health clinics and also children's environmental health clinics that don't just diagnose and treat patients, they do all sorts of education and outreach and advocacy on protective policies. One of the ways they were able to get those clinics established was by actually mapping the problems throughout the state.
Mm.
So Dr. Landrigan in New
Oh,
York.
Phil Landrigan, yeah. Mount Sinai?
Yes. So Phil Landrigan mapped the extent of children's injuries and illnesses, not injuries, I'm sorry, illnesses and deaths. And that this is the way he put it, due to environmental exposures across the state. Another example is in New York City, and I talk about this. There was an effort to eliminate pesticide use in public parks. And this was a long-term effort that took a number of years. One of the ways that they were able to accomplish this was by mapping pesticide use in city parks. And how would you know where pesticides are used in city parks? They got public records, they actually mapped it, and they made the invisible visible. I think environmental health leaders can explain, why do we do this? Why do we have this program? Why should we have this program? Why should we be composting our food scraps when it's an extra effort and we might have this, stinky bin outside our door? And they should be able to explain how that benefits public health, how that benefits, my family, my children. So I think there's an educational aspect to what we do that we can maybe do more of. Um, One best practice is to clarify the distinction between healthcare, which is what most people think of when we talk about public health, and population health. So again, I think this educational component.
That's
And
real Cree. I'm sorry, you have one more issue?
no, I think those are pretty much what I came up with.
That sounds great. Well, I want to thank you for your time this afternoon. For everyone, here's a plug for A Healthy Nation Island Press, available today for you. Susan, thank you for your time this afternoon. We appreciate it. Please, let's keep in touch.
That sounds wonderful. Thank you, Doug.
Okay, you take care.
You too.